welcome to your Nurse Companion Show, and I am so excited in today's show because you're talking about all things nutrition. And on today's show, I'll go direct to the point. On today's show, we have a nutritionist, a friend, and someone you will be interested to listen to. So, karibu sana.
Thank you so much, Carlo.
Yeah.
My name's nutritionist Suka Salani. I'm a clinical nutritionist and who plays a very big role in the society by advising the society on what to eat and not what to eat.
Yeah.
I play a very big role in disease prevention through using food as medicine.
Yeah.
Thank you.
And on your Nurse Companion Show, the biggest impact that we want is just to change one person. Si wengi, just one person is going to change their thoughts and prevent something, because as you have said, tuko hapa to prevent something. So feel comfortable, download whatever you have for us, and we are ready to learn.
Thank you. Today I want us to talk about malnutrition, specifically undernutrition. And malnutrition is always classified into two. We have the overnutrition and the undernutrition.
Wow.
So the overnutrition specifically deal with overweight and obesity, but the undernutrition specifically deals with lack of food.
Kabla tufike malnutrition, unaweza niambia nutrition ni nini? Nivyo niseme mimi niko well nourished. Like mimi niko na good nutrition. So what's nutrition for understanding?
So nutrition is a process, and it's a process by which a person eats a well-balanced diet. So that well-balanced diet can help fight diseases in the body. So you are either eating proteins, you are either eating vitamins, you are either eating carbohydrates, but in a balanced manner to help your body fight diseases or prevent diseases.
How do I know if I'm having the right nutrition?
Okay, to know how you are taking the right nutrition, your body usually functions very normal.
Okay.
By being normal means you have the correct weight for your body.
Correct weight?
Yeah, the correct weight for your body.
Right.
Something we call correct BMI. That is body mass index.
Lakini kuongea ukweli si ile mnatumia saizi ni ya wazungu.
Hata ikiwa tunatumia ya wazungu, it is a guide which the Westerns came up with for us Africans. Nowadays, tumeadapt life of Westerns in Kenya. Let me give you an example. Like in Kenya, kitambo, tulikuwa tunapata chapati only in December. Unaona Lakini nowadays, chapati ni kama kila siku. So unaona tumeadapt the Western culture in a way. So the nutrition we are using, it is the Western culture nutrition, but at least it is helping us fight the diseases in our country.
All right, now you can tell us about malnutrition.
Okay, malnutrition, specifically I will talk about undernutrition. And undernutrition is either lack of enough food in the body. Lack of enough food in the body? So when you lack enough food in the body, your body will either get certain diseases. And examples of these diseases are like kwashiorkor, marasmus, iron deficiency, anemia. And you know how anemia really affects especially our children in the society. And many other diseases.
So that's malnutrition.
That is undernutrition.
Another type of malnutrition.
So undernutrition is really classified into three. So we have what we call protein energy malnutrition.
Protein energy malnutrition. Okay.
And this protein energy malnutrition can be the kwashiorkor, can be the marasmus, or combination of both. And there's a certain way our body behaves when it has malnutrition. That is undernutrition. So let me give you an example, because for me specifically in the society I deal with children. Undernutrition, like kwashiorkor and marasmus, there's the way we differentiate it. Like who is a marasmusic child who is a kwashiorkor child.
The features when yanakuja kika.
So there is complications which are associated with marasmus and kwashiorkor. First complication of kwashiorkor because it is very common.
It's common.
Yeah, it's common. Like now, let's give you an example in areas where, like Garissa, Turkana, right now there is no rainfall. So what those children are suffering from, they are suffering from kwashiorkor and marasmus. So it's very common in our country, and we have very many rent-frax counties in our country. In our country, we have got 47 counties, but out of that 47, we have at least 7 counties which are really affected by hunger. Like I can give an example of Turkana, Garissa, Moyale, those signs, Like,
but is it common in like Kirinyaga? In Kirinyaga, have you seen any marasmus or kwashiorkor cases?
Yeah, it is common in our county. It cannot at times it cannot be so severe, but there are those severe cases we usually report every month.
All right.
Yeah.
So that's protein, energy,
malnutrition.
What else is there?
So what the word protein, energy, malnutrition means, either the child is lacking enough protein, either the child is lacking enough calories. And that's now the time we come with the classification of now protein, energy, malnutrition, where we deal with as I said earlier, we deal with the kwashiorkor and the marasmus, or the combination of both.
Yeah.
So how does a kwashiorkor child behaves?
Yeah.
This child will come into our clinics. We'll take the weight and the height of this child.
Yes.
So once we take the height and the weight of the child, we will classify that child as either severe, moderate, or mild, or normal.
Okay.
So there is a guideline we are usually given now by the WHO, the World Health Organization, to classify the malnutrition. We call them the Zendi scores. We use the Zendi scores to classify this malnutrition. So after taking the weights, where the child lies matters a lot. So the child can either be wasted or stunting.
Wasted ni muscles, unaona like kangozi lakini hakuna kanyama.
Hakuna kanyama. And that one mostly affects the children who have marasmus.
Okay.
Or combination of both. Like in cases, in most of our clinics, children, we see the combination of both.
Marasmus and kwashiorkor.
Marasmus and kwashiorkor. Where you see the signs of kwashiorkor and see the signs of marasmus. So a kwashiorkor child has got edema, like in the lower legs, on the upper extremity or the lower extremities. So they look like they have a kameno, like a moon. Kamefula maji.
Na kanatoa maji na kanakosa cha protein enough.
So the pathophysiology behind this, what usually happens, once the body is deprived from protein, so the water accumulates in the cells. And that's now we come with the term kwashiorkor.
Okay.
Yeah. But for a marasmatic child, this child is lacking enough calories as well as protein. So the child looks so emaciated and the child is very alert. Actually, you can be giving this child a lot of food and you are killing that child.
Wow.
Yeah.
Okay, we shall come to management. But now, okay, tuendelee another type of malnutrition.
So that is the major ones are now the kwashiorkor, marasmus, or combination of both.
Okay.
And then from there we should move to how they are classified. They are classified as either acute or chronic. Like where it is happening in Garissa and Moyale, we have now the issues of the something happening all of a sudden.
Okay.
And that one, what we call the acute.
Yeah.
It has just happened that there is no rainfall and there is hunger. That's now what we call acute malnutrition.
Yes.
And that's now we have the severe cases of malnutrition. And it is very painful for our country.
Yeah.
Because at this stage, the child has got very little weight for the height.
Into stunted growth.
It is now known as the wasting. Yeah.
Okay.
Then we have now the chronic one. Now you are calling the stunted growth. This child has got very little weight for the age.
For the age?
Yeah, for the age. That's the difference. Now the child is not growing well according to the age. Mark you, stunting can only be corrected into 2 years of life. If you don't correct that case, that child will never be corrected of stunting. But for the wasting, this child you can easily correct with food. So what is happening in those areas, if it is just lanes once, we are going to collect that malnutrition. Yeah.
Sasa huu mtoto ndivyo mamake akuja, because lazima akikuja hospitali they have seen something. What are the main common signs that you have seen with these women coming to report on the children? Lakini wengi unakuta wamekuja clinic, maybe alikuwa amekuja clinic ya vaccination, yanaambiwa na nurse this child is malnutrited. What are the common signs that you have seen among these children?
Okay, as you are saying, the major common signs is the mother comes to the clinic. But there are those common diseases, illness which these children get, like the cough, low HB, but you cannot see it until you send that child to
the lab.
But at times you can see the paleness of the tongue, of the eyes, of the, like the kwashiako, the hair is brittle, imesimama hivi. Nywele ya mtoto imesimama hivi.
Ile ilikuwa inakaa brown, tulikuwa niko na kwashiako.
The brown hair, now you are together. Then the child may be too thin. So there are several things we do, like for edema. We usually test the edema. So once you weigh the child, now you tell the mother to remove. You should not weigh a child in the clinic with the clothes. You should remove everything. So there is a way we assess the edema now, if this child is severely malnourished and has kwashiako. So we usually tap on the areas where the edema is. First we start with the legs. So we place using the criteria, like if I'm placing you like this, I use the criteria we call, like let me use Kenyatta 1, Kenyatta 2. By the time I say Kenyatta 3, there will be a depression.
Atakuwa na kashimo.
Kashimo.
Nipo naona uko na edema.
Na ako kashimo, ndio kata tuambie sasa huyu mtoto ako na edema, but we usually classify this edema into 3 grades. So kama ni kule chini kwa miguu, the lower extremity, that's grade 1. Ikipanda panda huku juu inafika grade 2. And when it continues now up to the face, it becomes grade 3.
And that's very severe.
And that's very severe. That child require hospital admission for the nutrition management.
Wow, and then you're having a likelihood of children even having TB. Na unasikia mama akikuuliza, but kwetu hakuna mtu amegonjeka TB. Na watoto wa malnutrition. What's the connection? Because they are there.
Okay, lack of proper nutrients in the body leads to body complications.
But the baby is feeding well.
And the baby is feeding well. So, low immunity. And the first defense against immunity is enough blood in the body. So, mostly these children lack enough blood in the body. And this will make them develop lack of askari to fight the diseases in the body. So when they pass by, even if it is in the hospital or in the market, they will contact the disease, even if a family member never had the disease. So even if they pass by where there is that bacteria of TB, they will contact the bacteria.
Any other common condition yenye nakuja na hao watoto when they are malnourished?
There are so many conditions. Like there is a phase we usually call adaptive reduction phase, whereby you find all the body shutting down. So the system is shutting down in a way, like if it is the heart, the blood volume is being reduced, because a child who is malnourished cannot be able to pump blood well. So even you cannot transfuse that child with blood. Never. You must first make sure you undergo what we call the 10th step of severe malnutrition management, where you manage the child very closely to ensure at least you treat the illnesses, then you do so many things to at least transfuse that child with blood.
Well, this mother who wants the baby to really add weight, because I have scenarios of such mothers, they have been told they have, and you have met them, when they have been told the child is malnourished, and they want to really try and add the weight as much as they are going through the steps as you have told them to. So encourage this woman, because akisikia kutoka nutritionist, tunajua nikiambia na nurse saa zingine ni kama hitingi, lakini kimwambia it takes, how long can it take to see improvement of adding weight?
Okay, improvement of adding weight really starts with the type of disease this child has. If the child has got lack of calcium, you know weight gain is very slow. If the child has TB, which at times it does not show until further investigations are done, and even further investigations done, the disease does not show. So to the mothers who want the child to add weight, you must follow the guideline given by your doctors and nutritionists and pediatricians. So we usually put these children in a clinic. Number one clinic is every month you must visit a nutritionist. Then every month you must visit a facility for growth monitoring to monitor the child weight. Then number three, you must see a pediatrician who usually see that child. If any other things erupt, the pediatrician is able to treat the child.
Okay.
Then from there, usually give the child supplements, which help the child grow well and add weight. We call them nutrition supplements, which most of them, maybe I can show some of them to you. So that's those mothers who may need, usually Kitambo, the government used to buy these supplements, but and even sometimes it buys, but they are very expensive. But once now the USAID governments withdrawn its care, at times our children, our population is suffering, but the government is trying its best to buy for its population, but they are very expensive. So there are nutritionists who usually have these supplements, and they also sell them to help the patient fight these diseases.
Wow.
Yeah.
Wow, that was a very short educative session that we just had. That to everyone that is watching, ama you have seen a mom, ama you have seen a child that is having this recurrent anemia, recurrent infection. I guess it's high time we go and check for a nutritional review, or to check if they are undergoing any other issues, as isipokuwa hizi homa na kifua. I experienced that when having my child. Before I knew they were suffering from anemia like HB of 10, 11. They really had taken medication. Lakini the more I boosted the HB, says it mimi na daktari atupatani. Sawa. So have you followed Sue? You're calling yourself in Sue Kasarani?
My name is Nutritionist Sue Kasarani.
Nutritionist Sue Kasarani.
In all my platforms.
In all the social media. So kindly, if you know the effort that it takes to show up this day, kindly just go subscribe to her her platform, go into her lives. She does more education in her lives. So always follow her, learn more. And anyone who has not subscribed to a You and Us companion show, we go live sometimes and on our platforms, You and Us companion, Facebook, YouTube, Instagram. And please subscribe to our show. It takes so much effort to get here. So please subscribe. And the next episode we are doing is management. So kindly subscribe and watch for the next one. Bye.
Thank you.